Because right now do you know how I do that?
When's your training?
In 15 minutes.
Okay, hold on.
I do not want this background. Okay. Choose virtual background. There we go. There we go. None. Normal. Okay. Oh, but that's recording. Cool. That's what I didn't. Hi, everyone. Would you all, or would a couple people mind just typing into the chat section and confirming that you can presently hear me? Yay! Okay, perfect. All right, y'all, we are going to get going here in just 1 second. I want to make sure, I'm trying to make sure I've got everybody in. I believe I've let everybody in. I don't see anyone waiting. I apologize. This is, we're learning as we're doing. So learning and doing at the same time. My name is Kimberly Ernest. As many of you already know, I am a licensed psychologist in LPC here, and I am going to now share my screen with you all so that you can see our PowerPoint presentation. Hopefully everyone can see that as well. And let me get my chat bar open just one more time. Where's the chat? All right. So I've got the chat open down here. So if anybody has any questions throughout today, feel free to go ahead and type it in there. I am happy to I am happy to answer them as I go. I am also attaching and sending two documents through the chat. So let me find the other one. And both of these documents are resources for you all. I am updating them as we go. So, but these are some great online resources for everybody. I'll also distribute via email and they will be saved on the hub, but recognize that this is a working document. So it may change as we go along here. Okay. I believe everyone should be able to see my PowerPoint. Can just one or two people type in there and confirm that you can see it? Yep. Okay, perfect. All right, y'all. Well, I am talking to you from my home during nap time. So let's hope that this goes well. Daycare's closing has been a barrier for this working mom, but we are going to get going and talk a little bit about support for our high-risk clients during the COVID-19 epidemic. I know that personally, I have been losing sleep at night over a number of different issues, but I have been really concerned a little bit about our very high-risk clients, our high-risk populations, as we begin to work through and sort of navigate this crisis. I think some of my biggest concerns are associated with our those that are struggling with SMI, those with a history of substance use disorders. I was watching a really good presentation from Dr. Drew a little bit early. I love Dr. Drew. I was watching a really great presentation with Dr. Drew, who was kind of going through and discussing some of the barriers and some of the concerns that we're going to see with our substance use disorder groups, that these individuals, that we're going to see high rates of relapse because of the social isolation, the boredom, all the things that we're chronically teaching our clients about relapse risk. They're all coming true right now in the midst of social distancing, which is excellent and is definitely something we should be mindful and aware of, but also a significant barrier to some of our most vulnerable populations. So we are going to keep working through. And I am checking to make sure I don't have anybody stuck in the waiting room. Okay, I don't think anybody is. So hopefully everybody's here. All right. So first and foremost, I would encourage every single person on this call and every single person currently practicing to be calling and checking in with all of our high-risk clients more regularly than usual. This would include clients with substance use disorders, those with a history of suicidality, homicidality, or self-injurious behaviors, high crisis populations, justice-involved populations, and clients with psychotic disorders. I would say all of these individuals are going to be more heavily impacted by the current stress that we're all experiencing. And we really want to be mindful and aware of how some of their previous coping skills or safety plans or crisis plans may no longer be accurate. One of the resources that I sent are food resources during in the middle of COVID-19, but I know that we had kiddos that every day they rely on access and food at school. So just be mindful and aware of the community resources and how they're constantly changing, and how that might impact some of our clients. During the check-in call with your clients, update and review support plans as needed. Provide with crisis intervention phone numbers, as well as information with remote resources, which you can see through that handout. I broke it down by a number of different presenting problem, but there are a number of online 12-step meetings. There are online mental health support, suicide prevention. So all the different things that we might have access to in person, now we have access to online. And I guess we always have, but I've never had to look for them. So there they are. They're available to you. Please review with your clients their history of successful coping, and then look at how those coping skills can be adapted for our present circumstances. I really think it's important for us to be mindful of diagnostic specific barriers for certain client populations. I was in researching and preparing for today. One of the things that I found was somebody talking about how they have a client with a psychotic disorder, and they have struggles with medication related paranoia. Um, and one of the fears for, oh no, I muted myself by accident. Am I okay? I think I'm good. Hopefully I'm good. Okay, thank you. Um, clients with psychotic disorders, and one of the fears was tied to their receiving their medication and not wanting to take their medication because they believe it could be tainted with the coronavirus. So I think it's really important to be mindful of how um, some of the national hysteria can be impacting and relate very directly to different specific diagnostic criteria. Clients with substance use disorders, obviously, or distress tolerance concerns may really be struggling with social isolation. Parents with a history of appropriate and healthy discipline might be struggling to treat their children in a way that is both safe and respectful. So I think it's really important to start thinking about our clients and then how this particular situation may relate very specifically to their own diagnostic or clinical picture. Clients with a history of offending behaviors or sexual offending behaviors. Right now, I know we're racking our brain to figure out how we can best support them because many of them are not allowed access to smartphones and telepsych. So how can we support them as isolation procedures increase? I know that right now I just was reading an incident report and communicating with our team leader because a client is self-quarantining due to exposure, but that client also happens to be an IOP. So as a precaution, we're canceling IOP, but to cancel groups, we also need to be mindful that we're then following up and rescheduling every single one of those clients for individual sessions, just to ensure that we're having that point of contact, that we're checking in. My fear very much for our substance disorder populations is that our relapses and our overdoses are going to increase. We are already in the midst of an opiate epidemic, so obviously this is not going to help that. There are, for individuals, I uploaded the handout for free lunch. There are also Comcast is offering free internet to families that are low income and otherwise don't have access. So just be mindful and aware of that resource will be available now, that Comcast can now connect our clients so that they can do their online schooling as schools are closed. Also, right before I popped on here, I'm recognizing that some schools may be closed for a while. I know that right now we're just closed through the end of the month here in the state of Pennsylvania, but I was reading that Kansas is now closed through the end of the school year. And so all of those kiddos are now transitioning to online or homeschool practices. That's going to be really stressful for a lot of our clients, especially our clients that don't have the resources at home. So constantly be out there gathering and making each other aware of the resources available within your local communities. It might not hurt to have a board in the clinic that you all post to, or an email thread that y'all are updating and sending out, with various resources available within your individual communities, and updates as those resources open or close or shift or change hours. Right now, it just feels like everything is fluid. It feels like every email I open, every news alert I get, something is different, something is changing. This insurance is approving this, but not that. And things are going to get a little muddy here for a while. So I think we all need to put on our most flexible hat and keep rolling. So when you're working with clients with psychotic disorders, I think it's really important to be mindful in discussing medication management and identify ways that clients can continue to sustain access to medication and support in terms of closures, and then also discuss how paranoia and other belief structures may be relating to medication management. With all of your clients, but especially with the high-risk clients, I would strongly encourage you to review support plans and update on the basis of available resources, and also review relevant and reliable resources with the client for information. I was reading about some clients struggling with psychotic disorders, and how they're kind of going into the far dredges of the internet and finding all kinds of strange and bizarre um, information that is probably not medically accurate. I think it's really important to also meet our clients with our calm and factual information from peer-reviewed or evidence-based sources. Um, I also think it's going to be really important to explore those fears and paranoia with our clients to ensure their safety moving forward. For substance use disorder clients, please, if you have to cancel, reschedule through technology. We are assuring that all of our clients still engage in treatment. So for clients that are criminal justice involved, they do not have to physically come into the clinic, but they must still schedule and have that point of contact. It's not the Wild West out there. And if they want to decline telehealth services, that's their choice, but then they need to come into the clinic. Um, I am assigning to our day reporting center clients daily online support groups. I know our Crossroads staff is working to get our where Crossroads is kind of, our internet is stuck in the early 2000s, so we're trying to get that sorted. But once we do, we're going to connect them to a bunch of online support groups. And in that document that I sent out, there's a number of different online support groups available, including one very specific to women, which I thought was a pretty cool resource. Update recovery and support plans, especially with churches closing. A lot of our AA and NA groups will not be meeting as they previously were. When I was reviewing some of the present recommendations, Dr. Drew was talking about how, as long as healthy social distancing practices are being maintained, that NA and AA groups should and will continue to meet, but have some distance between you and the person next to you. Make sure you have that 6 feet, coughing into your arm, washing your hands, don't touch your face, all that kind of good stuff. Small group attendance and treatment compliance will still be pretty essential during this time. And then also discuss access to MATs as closures increase. For anger management, or our clients that are struggling with parenting problems, maybe our clients that have been referred by CYS, or perhaps are step downs from family-based or MST, please review healthy conflict resolution skills. DBT skills are very helpful in this area, and there's a lot of free online resources. Also provide skills for anxiety, to reduce overall anxiety and support for clients in this sort of coming together as a community versus these explosive responses. Recently, I've been able to view a number of responses to the COVID-19 epidemic or pandemic, and I've seen sort of the best of the best and the worst of the worst and just about everything in between. I think this is the time that we really need to encourage and challenge our clients to be the best versions of themselves, and come together as a community. We want to encourage short-term solutions and problem solving during times of dysregulation and crisis. And so this might be the time to take off that insight-oriented deep work therapeutic hat and put on that case manager hat and make sure we are just kind of checking our boxes and making sure our clients' water is being turned on or they're not at risk of losing their electricity. I know that this is a time of great financial uncertainty for a lot of people. A lot of people are stressing about finances right now, and for very good reason. Discuss with our clients access to resources and what they can do to kind of sustain themselves. Um, Provide education on how to best support dependents during this time as well. Um, Parents that never wanted to homeschool are now homeschooling. So, reviewing things like positive reinforcement and sticker charts and all of the different resources that we have to sort of support these parents as they're during a very high stress time could be exceptionally beneficial. When it comes to our clients with a history of self-harm or suicidality, this is the time to update crisis intervention phone numbers and explore online resources. It's also really important that we focus on the installation of hope in all of our clients right now. And you know what? Maybe even ourselves, our families, and our coworkers. This is scary times, y'all. I think a lot of people are feeling very high stress, high strung, and worried about what is to come and what's next. During this time, instilling hope in our clients, letting them know that we will get through this and we will support them through this is essential. Address anxiety on a case by case basis, and really work to reduce or manage panic. Touch my face so much, it's ridiculous. Okay. Whoop. All right. For our clients that have a history of sexual offending behavior or criminally justice involved clients, that could include any of our domestic violence clients, anger management clients. Again, this is the time to update those safety plans. I know I sound like a broken record, but I mean it. I am kind of a broken record. Also, identify and structure things to prevent that boredom as a trigger for behavioral acting out. Implement accountability partners to ensure safe supervision during this time with reduced contact with the criminal justice system. I know that a lot of probation and parole departments are going remote or only responding to emergency calls, and be aware of criminal justice regulations associated with certain populations regarding access to technology. Specifically, our RSO population would fall in that category. So here are some resources about online meetings for substance use disorders. This is also in the handout that I sent out in the chat. And here are some resources for general mental health support. So right now, our game plan, our role, our job in all of this as social workers, counselors, therapists, clinicians, psychologists, our job is to seek to reduce unnecessary utilization of physical health services if at all possible. Right now, we are working with our clients to ensure that they do not result in hospitalizations or ER visits, if at all feasible at this time. Right now, we're focused on just navigating our clients through COVID-19. So that might mean that we're deviating a little bit from clinical support plans. I would argue that right now is probably not the appropriate time to like buckle in and do some deep therapeutic work when it comes to things like trauma histories or some other things. I think right now to sort of fall back and fall into crisis management is going to be most essential and beneficial to a lot of our clients. As a clinician, I think it's really important for us to stay calm in all of our client interactions, to seek support from your peers and your coworkers from 6 feet away. Disconnect and recharge. It's important to turn off. I know right now it feels like the work is never done, but you really need to be mindful of that. I found myself yesterday really, really dragging, and at 9:30 at night, as I'm still trying to answer emails and sort through resources and documents, prepare for today, all the 6,000 different things that we're all doing in 60 different directions. At 9:30, I had to tell myself, like, you need to go to bed. This can't be another all-nighter. This isn't going to work. This is going to be a marathon, not a sprint. I think in the weeks and months that are coming, we're going to have to really come together, be creative, and work hard to support our clients through this. Please seek additional supervision and guidance for your highest risk clients. If you need a case consult, shoot me an email, give me a call. My cell phone is 717-304-1980. Oh, someone can't hear. Can other people hear? I'll type. Okay. I just typed my cell phone in there. So Save that into your phone. If you have a crisis case right now, I am on call 24/7. So give me a call. I'm happy to help. Of course, I say that right after disconnecting and charge, but I mean it. I mean it. Seek additional supervision and guidance. Use whatever you need to. Right. But also connect to your family, spend time with your kids, spend time with loved ones, watch bad reality TV, cuddle a dog or a cat, do what you got to do. I linked on here some great resources. The one is the Calm app, that we do have a 60-day free trial for any of our staff to sort of help and support you through this time. I also put a podcast on here from our ethics guy, Dr. John, and he has a 2-part podcast, each an hour long, on the ethical implementation of telehealth. And I think as we're starting to move that direction, I know for me, a really deep form of self-care is to feel competent and to educate myself, especially in areas where I'm experiencing anxiety. And so those 2 ethics podcasts, I haven't been able to listen to them the whole way through, but the parts that I've listened to have been phenomenal, and I cannot recommend them enough. And then also Headspace is offering free access to healthcare providers, and any of our, I believe licensed staff, but I think also unlicensed staff can apply for it, and receive access there as well. And that was a resource actually sent to us from Trish Young. So she's still thinking about y'all, even though she's not here. There we go. All right, everyone. Last but not least, any questions, anything that I can support for you? I'm going to send this webcast out as soon as it processes from Zoom. And I will also send out those links. But are there any questions? Are there anything I can answer for anybody at this time? If you have any questions, just go ahead and type them into the chat box, and I'm happy to answer it. Nothing? I'll wait one more minute before I log off, just to make sure. Lou, come here, Bubba. In the interim, do you guys want to see my big fluffy dog while I wait for questions? Come here, big fluffy dog. No, you're not in the picture. Come here. He's being shy. But here's a big fluffy dog for everyone. He's certainly keeping me sane. So there's a big fluffy dog for everyone to view. And he's very happy. Hopefully when this is all over, he's going to start coming to a staff meeting near you. Can we end an intake if we don't trust the environment? Melanie, can you say a little bit more about that? If we don't trust if the client is coughing and sneezing, and so is the child. Yes, but they were already present. At any point in time, once you have the documentation completed, from like the signatures at the very beginning, and we are working on getting that all live for remote. We're just not there yet, but we're working very hard, and we're advocating to allow to have intakes electronically. Anything you do, just make sure it's documented accurately. Right now, we are really we want you to trust your gut. We need to make sure that our staff are safe. So we empower you to make that decision. Just ensure that if you do that, if you do end the intake, that you are documenting that accordingly. Wash your hands when everything's done. Tell the staff as you turn in the paperwork so that they know as well, or use gloves as you handle it. Yeah, if you need to end the intake, that's okay, absolutely. Just make sure that you document that correctly so we don't commit fraud by billing it erroneously. And it could be that family heads home and then you complete the rest. You can complete the rest via phone, or doxy.me, and then you can get the client into services through telehealth ongoing. But yes, if you have to end the intake or end any session, frankly, just make sure that you change the time in and time out and adjust the CPT code to ensure that No fraudulent billing is done. And I would also just connect with a supervisor if something like that happens. Did I answer your question, Melanie? Just confirm and make sure I covered it. Okay, perfect. If we are using telehealth, do the sessions need to be conducted at our local offices, or can we do these sessions at home? We are seeking clarification on that. We are not, right now, it has to be done at the offices because that's what the regs say. But the recent regs, they are releasing um, they're releasing regulations time and time, like every day we get so many emails from, and y'all do too now as a result. Every day we are getting a ton of emails with different updates from different insurance companies with different providers. And so what we are trying to figure out is what that is going to mean for every individual client. And not all private insurances are still allowing telehealth, and then some are allowing telehealth but only for certain providers. So Highmark, for example, not allowing telehealth at all. I have a few choice words for them. And then like Capital Blue Cross is allowing telehealth for psychologists and licensed clinical social workers, but not allowing telehealth for LMFTs or LPCs. So right now, nothing is making sense. Historically, the rule has been telehealth has to be from office to client, but we are reaching out to everybody and trying to get approval to do things a little bit differently. And I would stay tuned for that. I suspect that will be transitioning in the future. Or that's what we're driving towards, or trying to allow. With the caveat being, your offices are safe if even if we do implement that, if for whatever reason you don't have access to that at home, you don't have um, good enough or secure Wi-Fi, if you live in a region that doesn't have good internet, you can still come into the office and work in your office with your door closed. And no matter what happens, that will always be approved. And frankly, you're 6 feet from anybody else, and you'd be safe in that environment as well. So even if we do roll that out, and that is what we're working on and driving towards, you can still operate from the office if that's your need. Um, did that answer your question? Okay. Uh, but stay tuned. Like everything. No, there are no rules anymore. Everything's fluid. Any other questions? All right, then I'm going to go ahead and log off for now, but you all have my cell phone, you know my email. Like I said, things are changing, constantly changing, but we are trying to provide you all with the most up-to-date information. I know that many of you are now signing up for different things from different national news organizations. I think that's wonderful. I've had a lot of people reach out to me individually asking for different pieces of information. And we are trying to provide everybody with the most up-to-date information, but also trying to be mindful of the fact that 60 emails a day isn't always helpful. So we're trying to wait at least a few hours in between each update to make sure that we can do multiple bits of information in chunks at least. I recognize that this is super high stress for all parties involved, and I am just so appreciative of everyone coming together and working to figure it out. So again, any questions, please don't hesitate to reach out. Anything we can do to be helpful or supportive, we're open to ideas. We are just trying to get things sorted. So please don't hesitate to reach out. I hope everybody has a wonderful rest of their day, and I will talk to you all later. Bye.